Welcome back to McLaren Port Huron's Today's Health Program. We're talking today with Dr. Leonard Karadimas about arthritis of the knee and treatment for it. Dr. Karadimas, what are the surgical treatment options for arthritis of the knee?
Well, the definitive treatment, the way you actually fix a very arthritic knee, a completely worn out ball bearing, is you replace it. Everything else that you do would be to try to make it feel better, maybe make it last longer. So the definitive treatment for symptomatic osteoarthritis is going to be a knee replacement.
Tell us about what happens in total knee replacement surgery.
Okay, so I will show you this x-ray here that we had up from the last segment of showing a very osteoarthritic knee. Again, you see complete loss of joint space, spurs forming all the way around here, and the knee is sort of in a little crooked position here. And this is actual patient of mine, and then we have an x-ray of afterwards. Same patient, basically I removed all the spurs, took all the spurs out, removed some bone at the top of each side, replace it with metal, and there's a plastic cushion between the two, and now we've actually straightened the knee out as well. So what happens is basically when a knee wears down and you lose the cartilage, you have bone on bone or nerve on nerve contact, and that's what causes the severe pain for people. So I have a model of a knee replacement right here. So basically you lose the cartilage, you end up with bone on bone or nerve on nerve contact causing pain. So what we actually do is we will go into the knee through a limited incision and basically remove 2 to 6 millimeters off the end of the tibia, the same off the femur. Then we will put in a metal component onto the tibia, plastic component over that, as well as a metal component at the end of the femur, and then kind of pop that into place, and that is the new knee. So you've taken that bone on bone, nerve on nerve contact away. Now the interesting thing is the advancements that we have made in knee replacement surgery. And the big thing is, certainly there's a lot of excellent things that have happened with instrumentation and so forth that made it more precise. But it's the sizes that really, and it's a small thing, but it's made such a huge difference. So years ago, we would have, let's say, about 7 sizes. 7 size femurs, 7 size tibias, and then these cushions here would be 5 different sizes in increments of 2 millimeter changes, okay? So, if we had to if you were in between, we kind of just fit the one that fits you the best. And that would be like going to the shoe store and then having, even sizes or let's say all sizes, 8, 9, 10, 11, 12. And then you would get that shoe and it would kind of fit you, and you'd be, find a shoe that fits you. But imagine if you went to the shoe store that had 8, 8.5, 9, 9.5, all the way up to whatever, 13. And they also came in medium, narrow, and wide widths. We'd really be able to get a shoe to fit you well. And that's what's happened is now we have, instead of 7 sizes for the femur, there are 10, but they're also narrow and wides. See, the tibia, and then these components here are in increments of 1 millimeter increments. So I can actually adjust your knee 1 millimeter at a time.
Wow, that's
to get
amazing.
And so by doing that, we've been able not only to get a perfect fit for people, but by having that perfect fit, we've been able to lengthen the lifespan of your knee. If it fits better, it's more, it's more snug, there's no looseness to it, it works better, and it lasts longer.
So what are some of the other benefits to having this type of total knee replacement surgery? And there's pain relief, there's better mobility.
So, in essence, when we, the indication for a knee replacement is going to be pain, and that's always been the case. So if you look at it from that standpoint, you have a very painful knee. What are your options? Knee replacement, we do it. It has a very high success rate. Certainly, we like to get people, better range of motion, straighten their knee out, make it more stable for them, and those things all happen sort of because we fixed your knee for you.
So what would the patient experience going into surgery having this procedure done?
So typically it's about a 2-hour procedure. So you go to the hospital in the morning, you do the surgery, you're in your room a few hours later. The great new things that have happened in knee replacement surgery is our ability to do it minimally invasive through smaller incisions. We used to just give people a couple of pain medications. Now we use a variety of them, so it helps really keep their pain down. But the really cool thing has been is we are now using local agents, long-acting local agents, like long-acting Novocaine. Novocaine traditionally lasts for several hours. There are new Novocaines on the market that last for several days that are slow release. And we can inject those around the knee, which makes it much more comfortable. You can get up, we try to get everybody out of bed and walking the day of surgery. And most patients are able actually to go home the day after surgery, which is quite remarkable.
What would be the typical recovery for this type of procedure?
Nowadays, much faster than it used to be. I tell people the vast majority of the time you're going home the day after surgery. You're using a walker, crutches for a week or two, a cane for a week or two. So theoretically, at a couple weeks, you can be walking independently. Once you're walking independently, you're driving your car. At 2 weeks, it used to be 4 weeks for outpatient therapy. Now everybody gets into therapy at 2 weeks. And I used to tell people about 3 months for really, pretty good recovery. I've shortened that back to a couple of months now to get back to doing most things you want to do.
So you mentioned with the new joints that are available that it lasts longer than the old ones.
Yeah, traditionally, I mean, when I first started and practiced, or when I was a resident, we used to tell people, 10 years and then kind of creep up to 15. So the new models we're using, based on studies and based on experimenting and so forth, we're thinking 20 to 25 years. We'll see 20, 25 years from now if that's true, but it looks like it's going to be 20 to 25 years.
So for that amount of time, what happens if you start to experience a failure again in the joint? Is it possible to go in and revise the surgery? It
is. So, there's a couple of things that are going to cause it to fail. Most commonly, it's overtime and it's wearing of the plastic component. So if the plastic component wears down over the next decade or two, you can go in there and replace it. Sometimes, though, once that happens, there has been some damage to the metal components, and lots of times if we go in there and do it, we just change the whole thing out, and that way it gives the patient another 20, 25 years, and that should be pretty good.
Dr. Karadimas, this has been great information. Do you have any closing comments for our viewers?
I think if you're having knee pain due to osteoarthritis, I'm big into joint preservation, and I think the earlier you get treatment, there may be things I can do for you to make your knee last longer and push that knee replacement out as far as possible.
Thank you for joining us today.
Thanks for having me.
And thank you for watching. If you have questions, need a physician referral, or have suggestions for topics you'd like to hear more about, you can contact us by calling Health Access at 1-800-228-1484. You can also watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.